Hello everyone, I'm here to give you a tutorial on the new drug chart for the new test of competence. So this is what it looks like. Okay, ignore the Ormi use only because that is my company. Okay, that's the front page. The front page, you need to remember, this is where your scenario is. This scenario is from the assessment. Okay, you need to remember the drug chart, the drug round is here. This implementation round, you only have 15 minutes. Now it is like a booklet. It is very colorful. So this is what we're going to do. Turn the page over. On this page, guys, you need to remember the addressograph, meaning the patient's name, date of birth, and the hospital number. Right. And then we have here the all prescribers must complete signature section, where you should see who are the signatories in this drug chart. So they're entries of signatures. And here is the allergy. It is actually red, but the color is a little bit faint now. So the allergies information. And then these are little tick boxes for doctors, but you don't need to worry about that. Next page. Another one you need to mention, addressograph. Okay, and here are the codes. The codes, and this should be laminated on the drug trolleys in each testing center, wherever you're going to take your test. Now, the once and only stat doses, you need to read per drug like this. Today, follow my pen, guys. Today, paracetamol 1 gram intravenously. The instruction is to give now. Time required at 9 o'clock. With prescriber signature bleep number present. Given by my colleague at 9 o'clock. The pharmacy checked it. Morphine sulfate today 5 milligrams intravenously to give now at 8:35 with prescribed signature bleep number present, given by my colleague at 9:10. And at 9:15 today, salbutamol 2.5 milligrams nebulization through nebulizer, prescribed at 9 o'clock, prescribed signature bleep number present. As I have said, it was given at 9:15 by my colleague. That quickly, do not stay too long. That is the once and only stat doses. Now we go to the next page. It is the same addressograph, guys, and the prescribed oxygen. There is no prescribed oxygen, if you can see. All right, there's nothing there. Right, you need to see this, if the patient is a CO2 retainer or not. All right, that's just an important box, but all you need to do is cast your eyes on there. Now, the best time to actually ask for the patient's observation is during this time, prescribed oxygen. Why? Because I train my students to ask the assessor, Miss Assessor, please confirm the most recent oxygen saturation and the rest of the observation at this point. Okay, now next page. This is now where the antimicrobial is. Again, same addressograph, antimicrobial. Now my patient is allergic to amoxicillin. You have to remember, guys, any patient who are prescribed antibiotic, always go back to the page where there is the information of your allergy, because most likely your patient is allergic to it. Well, most patients here are allergic to amoxicillin, or many patients rather. I do apologize. I will take it back. I meant many patients allergic to antibiotics. So you need to go back to that information where you can see the patient's allergy. Right, so if you see here, amoxicillin, and then the way you read it is this way. Amoxicillin, 500 milligrams, 3 times a day per RM for 7 days. Start date today, finish date in 7 days. Prescriber signature bleep number present. This is query chest infection for indication. Do read the times later because you will tend to forget the signature. It's part of the marking criteria. Now, at 8 o'clock, there is a code number 10. It was signed. If there is a code, meaning that drug is not given. So go back to the back page where there is an information of omitted doses of medicine. It is right at the back. What does it say? Amoxicillin 500. It should only be 500, guys, so that's a typo. And the reason was patient is allergic. The signature is there. All right, guys. So the patient is allergic to it, so they didn't give that. That's antimicrobial. So now my drug time, remember what we said earlier? It's 12 o'clock. 12 o'clock. So now what I'm going to do is make sure I code this, because the patient is allergic. Code straight away, guys, if you know you're not giving it and you know the patient is allergic. So I would code this. Remember this, I said this. Code number 10 and signature inside the box. It says here date and signature, so put the date of your exam. And then at the back you should write here at the bottom, today amoxicillin 500 milligrams per rm. Instruction, that is the time to be given is 12 o'clock. And then start today query chest infection, and then you can put 10 patient allergy and then your signature. Okay, so we're done now with the antimicrobial. Do not stay too long, guys, with reading the pages. Okay, you need to get used to this drug chart. This just doesn't, this looks confusing because it's colorful, but actually it's very didactic, which is quite nice. Check allergies, only one antimicrobial. Next page. I'm sorry, I'm struggling here, turning and then holding the camera. Next page. Check allergies. That's another antimicrobial section. There is no under my antimicrobial. Now we're going to regular medications. Look, guys, in the testing centers, there's at least 2 to 3 medications you are going to give. If you're only giving one, make sure you check your drug chart. Wonder why you're only giving one. Right, on the regular medication, this is how to read it. Atenolol 50 milligrams once a day per rm, ongoing. Start date today, finish date ongoing, prescriber signature, blip number present, due at 12 o'clock, due in my time. Miss Assessor, please reconfirm my patient's observation. It's satisfactory. Now you're going to dispense. So you will read the bottle and say, Atenolol 50 milligrams, expires 2020. 4, I'm happy to dispense 1. Say it all out loud. And then do not sign until the patient had taken it. But you cannot give it to the patient without giving the indication and at least 2 side effects. All right. So it says here AF. So it's actually given to you. But sometimes there isn't an indication. Use a BNF. All right. Some testing centers will allow you to use a tablet. Use it. Don't fake it till you make it. It's not right. Okay. If you had forgotten, then go for a BNF. It's the safest way to do it. Okay, don't make up any indications and side effects. Do you know why, guys? Because the assessors know these drugs by heart. All right, they have been doing this for many times. Now this is another medication that I want to check. I want to show you. Calcium carbonate 1.25 grams once a day per rm, ongoing. Start date today, finish date ongoing, prescriber signature, blip number present. At 8 o'clock it was not given. Hold on, let me just check. So you can talk to yourselves, guys. Right, on the omitted doses it says calcium carbonate 1.25 gram per rm, start date number 2, code patient was not on the ward. Okay, so Miss Assessor, my drug run is at 12 o'clock. And this was not given to the patient at 8 o'clock. Calcium carbonate has 2 actions. Miss Assessor, I would like to clarify with you that calcium carbonate is not allowed to be given with any other medications. Technically, I will come back half an hour after the patient had taken the atenolol. But for the sake of this scenario, please may I give the calcium carbonate? Or can I give the calcium carbonate? If Mrs. Sesser says yes, you have to give it. Okay, so give it, calcium carbonate, dispense. I will dispense one. Now, when you're ready to give the medication, guys, wait a minute. Let me just check. So also verbalize the back PRN. The PRN is right at the back. There is a PRN medication here, guys. It says cocodamol. Today, 60 milligram per 1 gram, 4 to 6 hourly per RM, duration PRN, start date today, finish date PRN, doctor signature, bleep number present, for pain every 4 to 6 hours. And then I would be asking my patient, so you should be asking the patient if they are in pain or uncomfortable. You don't have to ask that patient initially. Okay, right then. So every pages, it will tell you check allergies, check allergies. So this drug chart is telling you what to do. Check allergies, check allergies. Anyway, so I have prepared, if you remember, atenolol and calcium carbonate. Now, before I give to the patient, I would like to re-identify my patient. Hello, Mrs. Daisy Green. Please reconfirm your full name, date of birth, and allergy. And you make sure, guys, you are checking on the right page. Okay, so the right page is, so that's the front page. The right page, the right information with everything, including the allergy, is here. Okay, just page 2. Okay, that's the name and the allergies. Let the patient tell you who they are and what they're allergic of. Now, I'm ready to give the medication. So, hello, Mrs. Daisy Green. I have here your atenolol. This is for your fast heart rate, and the most common side effects, which may or may not happen, are leg weakness. You could feel a little bit dizzy as well, but don't worry. I will come back half an hour later to check on your observations and ask how you are. Don't forget, I will give you your call bell. If you feel any of those symptoms, please don't hesitate to press. If the patient says taken, then what you need to do, guys, is sign here. Sign and date. Make your date smaller than your signature, not the date bigger than your signature. Okay? Now, patient has taken. I'll wash my hands with alcohol. We have here calcium carbonate, Mrs. Daisy Green. Now, it has 2 actions, Mrs. Green. This can be a calcium supplement, or this can also be an antacid. So this helps protect your stomach lining. The most common side effect is constipation and a little bit of abdominal cramps. Let me know if you have any symptoms after I leave. And then if the patient says taken, where do you need to sign? Do not sign anywhere. Do not put the time here. Don't put the time here. This is not your box. This is the box of the prescriber. You put your signature here. You put the time you've given. So signature or initial, put 12 o'clock because it's a 12 o'clock drug round, and the date of your exam, all in one box, just under today. Why? Because if you put the 12 o'clock here, tomorrow they are potentially, or they could accidentally give it twice. So this bit is not yours. This is the prescriber's box. This is your box. That's the only box you have. So that is the tutorial. I hope you have learned. Thank you very much. Don't forget, please, to like, subscribe, and hit the notification bell. There will be more videos coming up soon for the new test of competence. Best wishes, guys. Bye-bye.